Welcome back to Windy City Live, everybody. Do you have trouble breathing? Do you snore at night? Are your sinuses driving you crazy? Well, there is help out there, and here to talk about it and talk about some options is sinus and sleep surgeon, Dr. Madan Kandula. Hi, Doc.
Hey, how you doing?
Doing well. Now, you are the founder of Advent, and at Advent, you specialize in treating people with allergy, sinus, snoring, and sleep problems. Tell us a little more about that.
Yeah, I mean, these issues are really common and really impactful. So lots of people suffer needlessly, despite the fact that there are solutions. And really, that's what we're trying to do, is match up the solutions that exist that we can offer to the patients that need them. And it's so many people are just needlessly suffering.
Yeah, I've actually been told I have a deviated septum, so I might have to come see you in this sense.
It's pretty common.
Let's talk about the breathing triangle. What is that exactly?
Yeah, the breathing triangle, it's the nose and the throat. So if you think about how anybody breathes, you've got your two nostrils and you got the back of your throat. That area is key. It's the key to life. If your breathing triangle is working optimally, you're working optimally. You're doing what you need to do in the day. You're sleeping properly. All's good. If any of those areas or any of those three locations are restricted, then you're restricted. And really, the morbid part of that is if all three of those are restricted, you can't live. It's sort of incompatible to life. So the breathing triangle is the key to life. It's how you breathe. It's how we breathe, again. And it's really important that people are, doing their best in those areas.
Yeah, and if you're not, and you're not taking care of those things, what type of issues could you be dealing with?
It runs the gamut. So if you imagine that somebody is breathing fine and all of a sudden you're strangling, you put your hands on their neck, you cover their mouth, and what happens is the body tries to fight to live. If that's been going on somebody's whole life, they just learn to live with it. And so people live with just compromised lives. So headaches, not being able to breathe properly, not being able to breathe when you exercise, not being able to breathe when you sleep. Snoring is a cry for help. Sleep apnea is the far end of snoring, which is when somebody stops breathing at night. So all of these things are interrelated. And unfortunately, these things that are interrelated in the rest of healthcare are separated out. And so what we do at Advent is we bring them together. If you've got a nose that's not working, if you've got a throat that's not working, then then we can help. And that really makes it simple, makes it easy for people to identify, am I a good candidate for some of the procedures? And I'd say, well, we don't know if you're going to be a good candidate for some of our procedures, but we know if things aren't working properly, our entire goal is to help you out. And that's all we do.
And Doc, at Advent, every patient's treatment is individualized. This isn't a one-size-fits-all, so to speak.
No, it's not. Everybody's different. Everybody's problems are different, and everybody's goals in life are really different. And so it's our duty to really understand what you're trying to accomplish. So first thing we do is understand what's your goal, and then it's tailoring a program that fits your needs. What we're really known for are office-based solutions, and so that's where we try to gravitate towards, is finding sort of a low-key, high-yield way to get you where you need to be. And oftentimes it's something we can do just in a few minutes, is changing somebody's life, which is something that's remarkable, and it makes us want to, sort of be passionate about coming to work every day.
Yeah, and you're best known for the balloon sinuplasty. What is that, doctor?
Yeah, it's a big word, two big words, I guess. But all that means is each of us has sinuses, which are areas in the skull that enter into the nose. If those openings into the nose aren't working properly, then you're not working properly. And so you either suffer with breathing issues, sinus headaches, sinus infections, all sorts of things. And so what we can do nowadays with balloon sinuplasty is look into somebody's nose, use a flexible catheter to find that natural sinus passageway, and then inflate a teeny balloon to open that area up. It's pretty remarkable, and it provides instantaneous and remarkable relief for a lot of folks. So these are things that we could only, back in the old days, only do in surgery. So now we can, in the office, do something under, really a minimally, a low-key setting to get somebody up and working, very nicely.
Yeah, and doctor, I know that your entire team takes care of the patient from very first visit all the way through the insurance company issues, and that can be intimidating.
Can be. I mean, somebody's coming in to see us because they've got medical problems, and so we feel that it's our duty to try to take as much of that insurance hassle away from them. Let's focus on the medicine. Let's focus on getting you relief, and then the nice thing is we're with the issues that we treat these very, very routinely, and so we have a nice working relationship with the various insurance companies to make it as easy as possible on you to get the care that you need.
And how can we find you, doctor?
It's really easy. It's just our website, adventknows.com. We've made it as easy as possible, just as few clicks as possible to make an appointment. You can do that online these days. Meeting appointment can be virtual, that first visit, or we can see you in one of our many offices. So whatever is easiest for you. At the end of the day, I think the key is just getting started, taking that first step to say, you can do better. And then our job is to guide you through to get you where you need to be.
Yeah. Now, since I said I have a deviated septum, have you been staring at my nose?
Yeah, I can't get my eyes off of it. No, not really.
Thank you so much for the great information, doctor. If you want to learn more about solving your breathing issues, head to adventknows.com. We'll be right back with more Windy City Live.